Welcome to our explainer. Today, we're tackling a subject every caregiver hopes they'll never have to use, but absolutely has to know: being ready for an emergency. Whether it's a simple scraped knee or something much more serious, having a solid plan turns that moment of panic into confident, effective action. So, let's dive in. Just imagine it for a second. A child gets hurt. Your heart starts pounding. In those first few seconds, everything is on the line. What do? Well, that's exactly what we're here to figure out. Over the next few minutes, we're going to break down the steps that give you that clarity, building a foundation for a calm and, most importantly, an effective response. All right, let's start with the basics, the everyday stuff. I'm talking about the bumps, scrapes, and bruises that are pretty much a guaranteed part of growing up and exploring the world. The goal here isn't to wrap kids in bubble wrap, right? It's to make sure that when those little tumbles happen, your response is confident, correct, and reassuring, every single time. So for minor cuts, the steps look simple, but the details really matter. First things first, wash your hands. Put on gloves. Then, when you wash the wound, using cool water is key. It doesn't just clean it out, it actually helps constrict the blood vessels, which slows down the bleeding. And here's the pro tip. If blood soaks through that first piece of gauze, don't rip it off. Just add another one right on top. That way, you don't disturb the clot that's starting to form. Okay, what about minor burns? The idea is pretty similar. You need to cool the area down. But, and this is a big one, you have to use cool water, not ice. Ice can actually cause more damage to the skin. And please, never put butter, ointments, or any kind of grease on a burn. All that does is trap the heat in and make it worse. Just keep it simple. Cool water, followed by a loose, sterile covering. When it comes to bites and stings, your response really depends on what or who did the biting. For a mild bee sting, it's all about getting that stinger out and soothing the area. But if you're looking at a severe allergic reaction, there's no time to wait. That's an immediate 911 call. And for any bite that breaks the skin, whether it's from an animal or even another person, your biggest worry becomes infection. So that means a super thorough cleaning is a must, and you'll definitely want to get a doctor to take a look. Okay, let's shift gears now. We've talked about the minor stuff, but now we have to get into the major medical emergencies. When a situation is potentially life-threatening, your response has to be immediate, it has to be decisive, and it all starts with knowing what critical signs to look for. So, when do you make that call? The answer is you don't hesitate. If you see bleeding that just won't stop, if a child is having any trouble breathing, if they're suddenly confused or they lose consciousness, or if they're choking, you pick up the phone. Calling 911 is always your first and most important move. And I really need to be crystal clear about this next point. What we're talking about here is an overview to guide you in the moment. It is absolutely not a substitute for getting real, hands-on professional training. We really encourage every single caregiver out there to go out and get certified in first aid and CPR. Choking is terrifying, and for an infant, someone under 1 year old, the technique is very specific. You're going to use a combination of back blows and chest thrusts. You lay the infant face down along your forearm, so gravity can help you out, and you give 5 firm back blows between the shoulder blades. If that doesn't work, you turn them face up and give 5 quick chest thrusts, and you just keep repeating that sequence until that airway is clear. Now for a child over 1, the technique changes. We switch to what's known as the Heimlich maneuver. The goal is the same, but the method's different. After trying those back blows, you'll stand behind them, make a fist, and place it just above their belly button. Then you give these sharp upward and inward thrusts. The idea is to create a powerful artificial cough that forces the object out. If a child is unconscious and they're not breathing, CPR is the next critical step. It's a combination of rescue breaths to get oxygen in and chest compressions to move it around. A lot of people think CPR is about restarting the heart, but that's really a job for the paramedics. Your job is to manually keep oxygenated blood flowing to the brain. You're buying precious time and preventing permanent damage, which can start in just a few short minutes. So up to this point, we've been focused on one-on-one emergencies. But now, let's zoom out a bit and talk about threats that can affect the entire group. A truly safe environment isn't just about having a well-stocked first aid kit, it's about having clear procedures for any kind of external threat. Okay, this is a tough one, but you have to be ready for it. Dealing with an unauthorized person trying to pick up a child. The absolute key here is to stay calm, but be firm. Your number one job is that child's safety. That means you verify their ID, you call the custodial parent right away, and you never ever hesitate to call the police if that person gets aggressive or refuses to cooperate. The absolute worst time to figure out a plan for a missing child is the moment you realize they're gone. Your response has to be instant, and it has to follow a procedure you already have in place. You activate the plan, you start searching, while making sure the other kids are still supervised, and you document every single thing you do. All right, we've covered individual kids and external threats. Now let's go even bigger. What happens in a large-scale event, like a natural disaster or a huge power outage? Well, that requires a whole different level of planning, and it's all built around a simple three-phase framework. This right here is the foundation of all emergency planning. It's not just about what happens during the crisis. Preparedness is what you do before it happens. Response is what you do during. And recovery is everything you do after to get things back to normal. A really solid plan has all three phases covered. During an actual emergency, your response is probably going to fall into one of these three categories, and you have to know the difference. You evacuate when the danger is inside the building with you, like a fire. You shelter in place when the danger is outside, like a tornado or a chemical spill. And you go into lockdown when there's a violent threat, which means getting into a secure room, locking the door, and staying quiet. So all that planning comes together in this clear flow of action. When an emergency happens, your prep work lets you move through these steps logically. First, you figure out what's happening. Second, you decide on the right response. Is it an evacuation, a shelter in place, or a lockdown? Then you activate your plan. You keep everyone informed, and you provide first aid as the situation develops. This chart says it all, doesn't it? Knowing what to do is a good start. Having a written plan is even better. But being truly prepared, the kind of prepared that lets you act without even thinking when you're under extreme stress, that only comes from doing regular drills. Practice builds the muscle memory that takes over when you don't have time to think. So we have covered a ton of ground, from scraped knees all the way to disaster plans. Now let's bring it all home and focus on the most important, actionable things you can do to be truly ready for anything. If there's one number I want you to remember from all of this, it's 72. In a major disaster, it could take up to 72 hours. That's 3 full days for professional help to reach you. That means your emergency kit has to have everything you need to take care of yourself and the children you're responsible for completely on your own for at least 3 days. So what goes into that 72-hour kit? Well, here are the absolute essentials. You've got to have water and food, a fully stocked first aid kit, a battery-powered radio and flashlight, and of course, all your emergency contact information. And don't forget the little things that make a huge difference, like diapers and wipes if you need them, and maybe some games or books to keep the kids calm and occupied. A calm child is a much safer child in an emergency. And that brings us to our last and probably most important question. You can write the perfect plan, you can build the perfect kit, but are you ready to practice it? Because at the end of the day, being prepared isn't about a binder sitting on a shelf. It's about having the confidence to know exactly what to do when every single second counts.